House Bill 250, sponsored by Representative Marsha Judkins and recently passed by the state's legislature, could provide a solution to current issues with the social work licensing exams by removing various examination requirements for licensure as a certified social worker or social service worker. Communities are struggling with persistent mental health crises and are facing shortages in the number of mental and behavioral health providers. In this environment, it is crucial to ensure those wanting to join the professions aimed at improving mental health outcomes can do so efficiently. Social workers compose one such professional group that could soon be facing massive shortages because of occupational licensing laws that severely restrict entry to the profession. Such laws restrict access through large education requirements, experiential requirements, and examination requirements. For social workers, it is the examination requirements that are particularly interesting. In Utah, according to the state's administrative rules, various types of social workers must pass a licensing examination administered by the Association of Social Work Boards, or the ASWB. Despite this widespread use and the intended purpose of these exams, their necessity and value have been challenged. Recently revealed pass rate data has shed light on first-time pass rates for the ASWB clinical licensure exam. This data, especially data that demonstrates a 20 to 40% difference in pass rates for first-time white test takers and those of other racial and ethnic groups, makes it appear as if exams are biased and, as a result, harm hopeful Black, Latino, Hispanic, and Indigenous social workers. Instead of serving their intended purpose, these exams appear to inadvertently promote economic protectionism and insulate those already licensed from potential competition of newly licensed professionals. The data presented about these tests should not be overlooked. It is a reflection of biases in our institutions that have resulted in careers being stalled, wages being lost, and communities being left without needed workforces. Potentially biased examinations and shortages in such a vital field are important issues, and it is important that occupational licensing is made to be an equitable and fair process to ensure that communities have the necessary workforce to combat poor mental health outcomes. House Bill 250 will work to ensure those outcomes are possible. We commend Representative Judkins for sponsoring this bill and helping establish policies that will promote better occupational licensing processes and work to resolve shortages in the state's labor market.